All right. Good morning, guys. It's Dr. Casey Pride. I'm here with, excuse me. I'm here with my good friend, Dr. Henele. He's someone reached out to me recently and said, I have someone that I need to connect you with. Someone who is extremely sharp, who has been investigating the COVID-19 data collection. And he said, you have got to speak with this guy. You've got to have a conversation with this guy. What he has to share is going to blow your mind. And just to give Dr. Henele a quick introduction, he's the founder of and executive community director for the Energetic Health Institute. He holds a doctorate in naturopathic medicine. He has a Bachelor of Science in mechanical engineering from UCLA. He's board certified in holistic nutrition by the NANP. He has over 20 years of teaching and clinical experience. And after graduating from UCLA, he was hired by a major aerospace company to be a primary database developer for the International Space Station program. So sharp dude. He's the lead author on 4 research papers on COVID-19 regarding significant inaccuracies and alleged violations of federal law. And he's been reporting on COVID-19 data since March 12th and has dedicated over 1,500 hours to the investigation of COVID-19 data accuracy and integrity. So Dr. H, I really appreciate you coming on for this conversation, my friend.
Hey, thank you so much for having me, Dr. Casey. I really appreciate this platform and getting a chance to share this information with your audience.
Yeah, absolutely, man. And I would love for you, I mean, I know I just gave a little bit about your background, but if you want to fill in any gaps and share really what led you to investigate COVID-19 data collection.
Well, being in the holistic field as we are, we've seen some really questionable things going on, as in the war between allopathic medicine and natural medicine and everything, which there shouldn't be. I mean, we should be working together to find the best solutions and see where things integrate on the patient's behalf. So we've seen some unnecessary stuff going on. We've had a lot of concerns about vaccines. I was not educated, like most doctors are not, in medical school about vaccines. I had to do my education after graduation. I am a vaccine injured American. I lifelong seizures. That's why I'm wearing these glasses, so that it cuts down on the flicker time on my screen. Mm-hmm. I just, in becoming a father, and I think this is really for a lot of us, when we were becoming parents, we have to start answering questions, right? So in becoming a father, years and years and years ago, one of my research topics when I was in medical school, actually, I did the smart thing of becoming a first-time dad and going to medical school at the same time, was I have to research the Hep B vaccine because I want to be able to know, is this something I want for my child when he's finally born? And the research was stunning to me. It was like, oh my God, why aren't we being taught this? What is in it? What are the ingredients? Oh my God, about the law and everything, and 42 USC 300 code. It just got me to a point, Doc, where I was like, there's something wrong here, and maybe what's wrong isn't ill-intended, but it's still wrong. And I think that started to become an exploration, a side topic for me in addition to nutrition and other things. Like I want to know about this because I want to be able to educate my patients and let them make decisions for themselves. I'm a staunch proponent of medical freedom. I'm a staunch proponent of freedom across the board. I believe that it's supposed to be where we make decisions that are best for us and our families, and they're fine as long as they don't infringe upon other people. And what I'm seeing happening is the definition of what an infringement is shifting. It's shifting to, you can get someone sick. And it's like, no, that's not the way the immune system works. That's not the way infectious disease works. It's about exposure, yes, but it's also about susceptibility. And we don't teach people how to make themselves less susceptible by improving their nutrient density, by improving their lifestyle, by improving the way they think and see the world, because we've seen that work clinically. I've seen it work clinically for 20 years. And I'm like, why are we not teaching this? So when this came up, it was like, oh God, I think this is going to be a mess. And so I started recording on March 12th, all of the data from Italy, from South Korea that I could get my hands on. I went to the Italian Ministry of Health and started getting their daily downloads of all their data and analyzing it and going, okay, I want to know what to tell my patients. I want to know what to tell my students. I want to be a good doctor, which means teacher, and advise them so that they can make decisions that are best for them and their families. And lo and behold, while we're doing that, whoop, here comes in all of these governors, and they say that, hey, no, you're going to do things our way, whether you like it or not. And I'm like, well, that's not right. And I want to be someone that is well versed enough on this issue to talk intelligently with elected officials and with the public and with other physicians and say, look, this isn't about politics for me. This is about our freedom, and this is about verifiable data. I do not want to exist in a scientific model that is a faith-based model. I want to exist in a scientific model that is evidence-based and that we can reproduce results and we can verify. I'm an ordained minister and I love faith, don't get me wrong, but I want faith to be faith and I want science to be science. And if we can do that, then we can actually get some things really, really accomplished. So my mission is, at this point, it was first to inform people as best as I could.
Sure.
Then it became an investigative researcher, and it took me down some weird roads, and with a team of great people. I mean, individuals and volunteers with incredible degrees and backgrounds, and from all spectrums of the political sphere, which I love. We're just Americans coming together, but now it's really just about informing as many people as we can and saying, hey, are we okay with this? As citizens of this great nation, are we okay with this? I'm not okay with this. But I don't want to press my belief system on someone else, because I'm not okay. That's a belief.
Mm-hmm.
But I can express exactly why I'm not okay with it. And I want to inform Americans so they can decide for themselves whether they're okay with this or not.
Okay. So what I'd love for you to do, man, is start from the beginning. What was fishy to you, and what did you start to find as you started to investigate this further?
Well, the first thing that was the big tip off was we saw in Italy that, because the first concern we all have as parents, right, is, oh my God, are my kids really at high risk, right?
Mm-hmm.
So in looking at the Italian data, and I know Bloomberg did a report on this on March 18th, that we saw this was affecting people of advanced age with pre-existing health conditions in terms of it leading to a fatal complication. Okay.
Mm-hmm.
We saw that and it was like, okay, all right, that sucks. But at the same time, we're not seeing it equally spread out across every age demographic. And that was very, very eye-opening to see that children, teens, young adults, no serious issues in terms of fatal complications. But advanced age with pre-existing health conditions, serious risk. And it was like, okay, this is interesting from a data point of view. We have a clear delineation of it, and that it came out before it really started taking hold here in the United States was like, okay, what we should see, at least in my opinion, in public health policy is let's protect our most at risk and let's go all in and protect them and take extraordinary measures to protect them. But let's keep things moving for everybody who's not, because that's going to create an opportunity for everybody to develop this quote unquote herd immunity, which allows those people highest at risk to reemerge back into society safely. So there was a logic. It's like, okay, there's a logic. Then we did some more research and we found that CDC actually admitted this on March 9th that, hey, if you're over 60 and you have a pre-existing condition, expect to shack up for a long time. Like it was on a CNBC coverage, and it was like, okay, all right, I'm seeing logic, and I'm like, okay, as long as we keep seeing logic, we're going to be fine. And then we saw some press conferences from the initial members of the press team of the presidential task force, the White House task force, and they said we're going to count everything, and it was like, whoa, okay, hold on. And so we started looking at some very important documents. We looked at the National Vital Statistics System's March 24th document. And they made some substantial changes to how death certificates were going to be recorded. Previously, if you had a comorbidity, a pre-existing condition, and those are not really synonymous, but in the public lexicon they are. You know, if you had a pre-existing condition and then you got sick and then that was the final straw, what would happen is in the death certificate in Part 1, you'd have listed all of your pre-existing conditions, and then the initiating factor, the last infection, would be on the bottom of Part 1 or listed in Part 2. Well, the March 24th document said no. For COVID-19, no. Now we want to list COVID-19 in Part 1 and list it exclusively, and all comorbidities are going to be listed in Part 2, which means those comorbidities are not cause of death, are not considered statistically a cause of death, a contribution to death, but not a cause.
Wow.
And that's a massive 180-degree change that was issued in a document, not in a federal registry. We need federal oversight on this change. We need to open up an opportunity for public comment and scientific review of should we do this or not. But no, we're just going to go ahead and do it. And I'm like, whoa, okay, that doesn't feel right. And then we saw a couple weeks later another document. The CDC adopts another document called it's from a outside nonprofit organization, not a federal agency. Right? The CDC is entirely capable of creating these definitions. They have PhDs, brilliant people at the CDC. They're entirely capable of doing this, but they outsource the definitions for COVID-19, what would constitute a COVID-19 case, a confirmed case, a probable case. They set the stage for what's called epidemiological linkage, which means contact tracing. They did all of this, but they let an outside nonprofit organization, the Council for State and Territorial Epidemiologists, define this, and then again adopted that paper in without any oversight, without any opportunity for public comment on it. And it changed the entire, we've never, ever, I can say ever one more time, never, ever done this. So why are we doing this? Why are we fools rush in? Why are we rushing in to make all these changes? Data collection is data collection. It doesn't matter if the infectious disease is H1N1 or Ebola, if you want to get really crazy with it, or SARS-CoV-2 virus. It doesn't matter what the infectious is. Data collection and the process is the same. It doesn't matter, you know. So why are we making all these changes? That became the question. And as we started going down that rabbit hole, of course, I started having other professionals join me in the research, and collectively our team has put in over 10,000 hours of research on this. And what it kept turning up was, this doesn't make sense. This doesn't make sense. This doesn't make sense. This data is compromised. The integrity of this data is compromised. We cannot trust this data that's being published and pushed out into everybody's TV set 24 hours a day for months and months and months, just, you know, forming this narrative that isn't accurate. And that's the concern. So for me, the motive was truth. You know, the motive is I want to be someone that can share information with people, and especially my patients and my students, but really now all citizens, and saying, hey, there are some things here that are very wrong, in our opinion. Let me be clear about that. These are allegations, in our opinion, that are very wrong, and they warrant investigation and discussion based upon the findings of that investigation. We're not calling one person out or saying you did this or shame on you. We're saying, folks, that with what's at stake, and we're seeing additional lockdowns, and we're seeing a prep for a second wave of lockdowns now in this country and everything, we are gravely concerned that this is being utilized, this situation is being utilized opportunistically to infringe upon Americans' freedoms. And that's, I don't care what side of the aisle you are politically, that's a concern.
Yeah. Yeah, and you know, I think you hit on something really important. If we're going to make good policy, we have to be making that policy on good information. And
right.
If the quality of information is poor, the quality of the policy is going to be poor as well. And I personally, I look at the policy going on around us, and it's pretty clear that it's absolutely disastrous.
Mm-hmm.
And what it appears to me like is the only factor being looked at by regulatory agencies, by CDC, by our government is COVID-19 cases. They look at, when they put a policy in place, what is it going to do to case numbers, and nothing else. There's no discussion of what are the unintended consequences going to be of these lockdowns. What are going to be the economic impacts? What are going to be the mental health impacts? It's just simply not being discussed.
Yeah, right. Well, and we did a little research on that too, Doc. So we looked at every single state COVID task force and the national task force on it as well. There isn't one economist on any of these task force, which is a problem. There isn't one social worker. All right, I'm very concerned about what we anticipate to be the highest number of suicides in our country in any year that have occurred this year. There are no law enforcement specialists on there to talk about, hey, what happens if everything gets really destabilized? There are no nutritionists. All right, I've talked with heads of public health departments. I've been lucky enough to get on private Zooms with them and say, hey, I want to share some of the data we've been finding. And this was before the CDC was forced to revamp their website, their data tracker website, and really share a broader spectrum of data with the public. What was shocking to me was that, one, the heads of the health departments we got on with did not know the demographic data. That was stupefying to me. Okay. And then when we talked to them about saying, look, you're going to issue guidelines about distancing and masks. Fine. Okay. Please let us help you put together nutritional guidelines, basic minimal guidelines based on evidence that has been collected around the world, scientific peer-reviewed evidence. Let's start putting out some guidelines so people can do more than just stay 6 feet apart and put a mask that we know today is not effective. Let's help our people. We pulled up the Linus Pauling Institute, which is one of our greatest research centers on nutrition out of Oregon State University in our country. They have a beautiful paper on natural immunity and how nutrition weighs into it. Over 279 references in the paper. And these heads of the health department said, yeah, we acknowledge that we've done a terrible job on nutrition, but we're not going to do anything about it. This is what we were told.
Wow.
I sent paper after paper to these heads. They wouldn't even get back to us. They won't even talk to us anymore. They won't even respond to us anymore. And I think we've done the same thing with elected officials. We've sent out thousands of emails to elected officials. I've done videos specifically for elected officials. We haven't gotten one response back. Not one, not even an automated response back to anything we've sent out. And that starts raising flags for us as Americans, right? I'm a dad, I'm an American.
Mm-hmm.
It starts raising flags. There's more ways for me to participate in my governance than just voting. And clearly we see the problems with that right now. All right. I don't care what side of the fence you are. There's problems. It's broken. But if we can't talk to our elected officials, if we can't talk to their aides, if we can't engage in our own governance, if we can't have legislative bodies come back into session to say, look, this isn't going to be a one person in the entire state decides what's right for everybody anymore. If we can't have that, then we're not working in the constitutional republic that we think we're in. And that's a big concern for me. I'll tell you straight up, Doc, I am gravely concerned for the future of all children and in this country. And I see it as my duty. I'm fighting for them. I'm fighting for them and for their future right now. And I'm hoping a lot of people will join me in asking questions. You don't have to fight, but join me in asking questions about this, because there's a lot of this that doesn't pass the smell test. You know what I mean?
I do, man. And I want to thank you and acknowledge you for being willing to step up to the plate on this. And the first question I have to ask, man, I mean, I don't know how anyone can look at what you're presenting and say, yeah, the data looks good. Mm-hmm. No issues here, nothing to see here. I mean, if anyone takes an objective look at this, it's pretty obvious that the quality of the data collection is really poor. But the question I think a lot of people are gonna want to ask is why. What's in it for the CDC to inflate the numbers? What's in it for our government to inflate these numbers and absolutely wreck their economies? I mean, what's in it? What's in it for them to inflate these numbers? I think that's the one thing that doesn't make sense.
Yeah, it's a great question. It's a great question, and it's, I think, the second most important question of all of this. I still am going to hold that the most important question for us, and we're not. I don't know when we'll get to it in our lifetime. But how did this start? I want a definitive investigation. How did this begin? If this is gain of function studies, we have to put an end to them. If this is rapid evolution due to climate change, we got to respond to that. But we got to get to the root of roots. But to speak to your question, I think the first thing I've learned throughout this is, one, I want to acknowledge everyone who has lost someone this year by any means. I don't care if it's COVID caused or not. I want to let every American know that I mourn with you. My team, we mourn with you. And I think one of the things that sucked this year is that so many people died alone, and that does not sit well with me at all. I couldn't imagine. My mother passed in 2002. I couldn't imagine not being able to be by her bedside because some hospital or some doctor told me there was a risk. That's my mom. You know what I mean? That doesn't. There's no way for me to be okay with that. And I also want to say give a big shout out to every first responder, every healthcare worker that has put themselves at risk to make a difference in a terrible situation. We have not given our healthcare practitioners, in my professional opinion, at risk of backlash. In my opinion, we have not given them the tools to be as successful at their job as they could be, as the energy they've put into being successful at their job. And I think that sucks too. When to speak specifically to your question, I don't know. I don't know what's in it for the CDC. I don't know what's in it for a vaccine manufacturer. I don't know what's in it for a political person who, anything. And I don't want to give the appearance that I'm saying that there is a definitive conspiracy and we've found it, and because then it's just going to be dismissed as a theory. And it's like, all right, hold on. But what I am saying is that there is enough here. There's enough here to warrant a thorough, independent, transparent, nonpartisan investigation of what has gone on, because the implications are dramatic economically, mental health, healthcare wise in general, public health policy, the election. The implications are of a magnitude we have never experienced in human history, in my opinion. And I'm a big historian. I love studying the Roman Empire and the Egyptian empires and the Chinese Empire. I love studying these things. We have never had a situation like this in human history, and we got to get this one right. And the only way to get something right, like you said earlier, is to have accurate information in front of you, which means we have to investigate, we have to research, we have to have access to everything that was going on. Because if there was malfeasance involved, we need to make sure those people are held accountable. And if there wasn't, then we need to make sure that we have a solid, logical plan that incorporates everyone, so that if this does happen again, because it was some kind of unexpected rapid evolution of a microorganism, that we're prepared. I'm a big environmentalist. I'm a big believer. We got to plant trees and plant them fast.
Yeah.
But I'm also someone that I have a hard time speculating on that, because the implications are that we could accuse someone or some agency of doing something very wrong when maybe they didn't.
Mm-hmm.
My research doesn't say that, but I want to make sure I think everybody deserves a fair shake, right?
Yeah.
So if you have nothing if everything was done with the right intention and within the law, the investigation will confirm that, and it'll help everyone restore trust. And if the investigation shows that there were some things that were very wrong, then we'll be able to get down to who did it, and then we'll be able to figure out why they did it from there.
Yeah. Yeah. I mean, the way that I, at least the lens that I see this through, if these numbers are being inflated like this, there either has to be incompetence on a level that we've never seen, or some kind of corruption and agenda on a level we've never seen. And yeah, go ahead.
Yeah, no, I that's been our conclusion too. Like we're all, I think one of the cool thing about being a doctor is you get trained on differential diagnosis, and you get into a habit of exclusion. You know, if it's not this, then it could be this, and then I test for this, and then if okay, it's not this, then it's this. And this opportunity of thought of exclusion helps you get down into, okay, it's this. We found it. You know, we found the issue, and that's doctors are some of the greatest investigators in the world. The ones that are doing, you know, we're trained to think like this, right? And I want to share something with your audience. I want to share that Council for State and Territorial Epidemiologist paper, because there's something in there really I have a huge problem with, and we've been talking with some top epidemiologists in the country about it and getting their opinions, and they've been actually getting back to us, which has been really awesome to see people coming together. And it's like, look, I don't care what your background is. I care about how you think. I care about what you do. You know, I don't want to speculate on anything. I want to make sure we're objective, but that's why my big push now in all the work that we've done is saying, look, let's get it out to the American people, and let's together call for an independent investigation of this, a grand jury investigation, which we have the right under the law to petition for, because we believe that a crime may have been committed. And it's important for a grand jury investigation to either confirm that or confirm that it hasn't. And either way, it helps to restore public trust in our institutions that govern us, and it shows us that we can participate beyond beyond voting, and that's what a good feeling that is, you know.
Yeah, and gosh, I heard a great quote recently that the government will respond to two things: a lot of money and a lot of people. And to see this happen, it's going to take a lot of people. And my question I would love for you to explain a little bit about what you're doing with these grand juries and how people can get involved in this, because I know you're doing some really big things at the legal level with this.
Sure. Yeah. Well, part of what's been interesting about our research team is that our research team started out with physicians, right, asking questions. And then it morphed into statisticians and epidemiologists coming on. And then that morphed into certified death reporting clerks coming on to validate, you know, what we did. Then then we brought in attorneys. Then we got a judge to actually look at our paper. This is all before it got published, right? So we went through, and then it went through a peer review process with the journal that the Public Health Journal by Dr. James Weiler. There's so many people that have tried to really tear this apart, and as we should, right? We have to make sure things get held up. We invited this, you know, nobody was being mean. We're doing our job. And it stood up each time, right? So in it standing up, you know, what became very apparent was that there's a lot going on with this, and there's a lot of nuance to it, and that's hard for people to go from I didn't know anything about this to oh my God, you know, and take it all in. It's dense, right? And we appreciate that. So what we've been working on is trying to simplify the message and make sure that people can start taking, you know, baby steps into understanding what we've found. I think that when it comes to what people can do, our first line that we think, and we're going to be sharing some resources in the coming days and weeks with Americans who want to get involved as well, because I think we have to start, if anything is clear, we have to start participating in our own governance. We can't wait and ask for permission. Forget
That's right.
that. And I want to be really clear, we are not advocating violence on any level. I've had enough of that. Okay. But I'm also not advocating that we sit back and ask for permission anymore either. There's got to be a way for us to apply pressure. We saw it work with the Big Ten for football. We saw it work with the Pac-12 for football. So that means it works. You know, we can do this. But like you said, it's going to take numbers, right? And get numbers, we have to get people informed on this.
Yeah.
So so for me, it's the first level is let's engage the Department of Justice. Let's engage our U.S. attorneys, and we may have a turnover of U.S. attorneys in the Justice Department. Who knows? So we might have to start the process all over. Who knows? But freedom is worth us fighting for it. Millions of Americans gave their lives so that we could live freely. I'm not going to let their memories go in vain because I wasn't willing to send an email, because I wasn't willing to fill out a web form, because I wasn't willing to make a call and then make it again and send another email and send another email and go and sit in somebody's office and wait for 4 hours to talk with them for 5 minutes. I'm not going to let that happen, you know, because I was unwilling to do that. And my hope is that there are millions of Americans who agree with me on that. That there are millions of Americans who say, you know what, too many people have sacrificed too much for me to have the rights I have right now. All that's being asked of me is to fill out a web form. Yes, I'll do it. All that's being asked of me is to email or call someone. Yes, I'll do it. All that's being asked of me is to share information and help inform other Americans, regardless of their political affiliation. Yes, I'll do it. I don't think it's too much to ask, and we're trying to make that process for Americans easy. We're not just this isn't just research for us. This is research with an end game. This is research with. I'm tired. And I'm going to rant a little bit. I'm tired of us being conditioned to get information through social media, and then be outraged, and that's the end of it. That outrage is energy. That outrage is energy that can be focused productively to participate in our own governance and help us tell the folks that think we don't matter, because that's been my takeaway this year, that hold on, I'm nobody special, but I matter. And I'm going to maintain the freedom that I was born into so that my children can have the freedom that I experienced as well. To me, that's what this is all about. And if somebody has a problem with that, then we're going to have a problem. And that doesn't mean I'm going to hate you and we're going to fight about it or anything like that. It's okay to disagree, but we're going to disagree on that greatly. I'm not going to let this country fall into this state of despair that we're falling in and do nothing about it. I'm not wired that way. I can't do that.
So what does this grand jury petition process look like, and how can people get involved with it?
Well, I'm glad you asked. And I think the first thing is this. The first thing is get informed. You know, I don't want folks just taking my word for something, my team's word, for hey, I saw this guy in an interview and now I'm going to. No, that's not good enough. Read the paper. If it takes you several days to read through it because it's dense, read through it. Make sure you agree with what we're saying so that you understand what's going on. This is my request. You know, you don't have to do it. You're a free American. You do whatever you want. But my hope would be that you read it and that it makes sense to you and that you go, okay, now I want to do something. I'm pissed. I mean, I'm sorry. I'm a little pissed by it. Believe me, I'm a little pissed by the research, what we found. But I'm pissed, but I don't want to just vent on social media about it. I want to do something. I want to be a part of the solution to this. And for that, it's okay. Right now, what we're recommending folks do is go to the Department of Justice website. They have a complaint form specifically for COVID-19. Fill out the complaint form and demand a grand jury investigation into how the CDC decided to collect data around COVID-19. Understand, that when you're asking and demanding a grand jury investigation, number one, it is your right as an American to do so. You have a right to petition your government to investigate. You are not making any allegations in a petition. You are simply saying, I want this investigated, as is your right as an American citizen. And once you've done that and you've filled out the form, reference the paper. All the information is right there in the paper for the justice. Just there's a little section I can actually show online if you'd like me
Love
to.
that, man. I'd love for people to be able to see that paper so they know what they're referencing.
Okay, so we can go through a full example in a second.
Sure.
But ultimately, folks, after you've done that, then it's all about phone calls, and we've collected the numbers for you to be able to call. We're going to be releasing that really soon. Dr. Casey's going to be showing you how you can access this information. We're doing everything we can to help you become an activist if you want to become an activist, and we hope you do. And it doesn't matter your background. It doesn't matter your level of education. It doesn't matter your age. And it doesn't matter your political affiliation. All that matters is you feel like something was done wrong and you want it investigated. That's all that matters. And that's all we're asking for, which I think is a reasonable request at this point.
I think so too. I think that's absolutely reasonable.
Yeah. So if you want, I can share screen and I can show everyone how to do it.
Yeah, bring it right up, man.
Okay. All right. Let me share screen here. Okay, there's a lot of tips here. Forgive me. I'm getting acclimated to this new video platform. Select window or screen. Okay. Give me a second here.
You bet, man. Yeah, StreamYard's a little different.
Yeah, it's just a little bit different. Where am I looking? Okay, this is the problem with having too many things up. Okay. So let me know if you can still see my screen. I'm switching over to where the paper is first.
Okay, let's see. I can add this to the stream here. There we go.
So the first place you can go is, this was published by Dr. James Lyons Weiler, who has become a really good friend of mine. We're really grateful to him and his journal for taking us arduously through the peer review process. I mean, it took us over a month. Actually, it took us about 6 weeks, almost 8 weeks, to finish the peer review process. So he was incredibly thorough, and we really respect him for all he's done for the research that we found. But it's on the publichealthpolicyjournal.com, and it's going to be /ethics in science and technology. Here's the abstract of it, and then you can click on the PDF right here, and you can read the full official paper. It started out. I'll let everybody know that this paper actually started out as a 60-page paper that we had put together. My team had put together, and we had to trim it down to 24 for the sake of space. We had to cut out major sections on global research on the efficacy of a number of treatments, including hydroxychloroquine and intravenous vitamin C, that have shown to be absolutely fantastic, Dr. Casey, in resolving any infections, especially in our highest risk populations. Just phenomenal research going on around the world, and why that's not happening here is another big question that we have. Let's see here. Let me pull up. So after you read this paper, let's say that you want to DOJ COVID complaint. Let's see if this takes us to the DOJ complaint form. There's 2 complaint forms actually on the Department of Justice's site, the DOJ site. One of them is just a general complaint form, and you can certainly fill things out through there. But another one is this disaster fraud complaint form, and this is where we've been focusing everybody. Can you still see this, Doc?
Yep.
All right. It's important to note that there is a disaster fraud hotline that you can call, the 866-720-5721. We've also collected numbers for U.S. Attorney General William Barr, and we've actually collected the contact information for every U.S. attorney in the country, and we're going to be releasing that with the release of the new platform that will be coming out very, very soon with all of this information on it.
And I'll make sure everybody, all my people get a hold of that as well.
Absolutely, we're gonna get it. So what we would say is this, folks. Very simply, check out the paper, read the paper. Maybe you've already come to your own conclusions because you've been doing a lot of great research on your own, and you're ready to say, hey, I want to demand a grand jury investigation into this. Then you would go to the DOJ site. You're looking for the NCDF disaster complaint form. And what that does, Dr. Casey, is that takes you to here. And the first option you'll see is COVID-19. And the box you'd want to check is corruption by state, local, or federal officials. Again, this is an allegation. This is not a statement of fact. This is just saying, hey, we believe that there is corruption that has occurred, and we believe federal laws have been violated, and we want to see a grand jury investigate this. And that is your right as an American to do so. One of our team members, Dr. Casey, actually wrote the book on grand jury. On grand juries and how to access them. He contacted us after he started hearing about our work, and he was like, hey, I don't know if you'd be interested, but I wrote the book on how to contact grand juries.
Well, that's awesome.
I was like, yeah, okay, tell us.
Wow, that's a great connection, man.
They've just been showing up. We needed to find a certified death reporting clerk, and we found her. We needed to find some attorneys, and we found them. And it was literally what's been so really blessed about this whole thing that we've been doing, Doc, is it's literally been within hours of us needing that, we found that person. It's been crazy like that. We needed a PR team to help us out. That day, I got a message from somebody that I know who I didn't know she was a PR specialist and had her own company, but she does. I mean, how crazy is that, right? I mean, it's like that's when you start knowing, all right, we must be doing something right, because there's a lot of good coincidences, happening, right? So basically, on this form, it's really simple. You fill out your name, you fill out information. You would just select here corporation, and you type in the CDC right there. And then what you would do is you would reference for additional URLs. You would just reference our paper. You could just copy this address here. Control C, since I'm on a laptop, and paste it here. And then you would just say in here that you believe that there's that fraud has been committed against the United States, and you want to see it's investigated. And go down, click submit, and then what we ask folks to do is keep filling out this form and keep calling and making your voice heard. All right, make them respond to you. If I can share one more thing, Dr. Casey,
please,
while I got it on screen.
Yeah.
Because this is a big concern for me, folks. Here are the two documents that the CDC has published. One is through the National Vital Statistics Systems, which is a subsidiary in terms of where they fit on the hierarchy of government agencies. They're a subsidiary of the CDC. They fall underneath them. But you can see the CDC published this on March 24th, and this was the problem. If the person who died had other chronic conditions such as COPD or asthma that may have contributed, these conditions can be reported in Part 2. That's never been the way we've done things before. That has always been in Part 1, pre-existing conditions. So this was a way to de-emphasize pre-existing conditions and really focus the cause of death as COVID-19. Even if a person didn't test positive for COVID-19. As you see here, they say COVID-19 should be reported on the death certificate for all people who died where the disease caused or is assumed to have caused or contributed to death, or assumed to have caused.
So what basis can they make that assumption on?
There you go. Well, they're basing that assumption on a paper that the CDC adopted without federal oversight and without opening up a 60-day mandatory process for peer review and public comment. And that paper was authored by the Council of State and Territorial Epidemiologists, And that is a nonprofit organization. That is not a that's not a federal agency, and certainly the CDC is incredibly capable of creating these definitions. Okay, they're incredibly capable of. You were talking about a building full of PhDs. Okay, PhD epidemiologists and infectious disease specialists and so forth. They're more than capable. And this document, though, look what it did. This document defines what are the criteria for case ascertainment. And let me show you what the minimal standard for defining a case as a COVID positive case, a COVID probable case, is. At least one of the following symptoms: cough, shortness of breath, or difficulty breathing. Right there. That's the minimum that a person has to show in terms of symptoms, or be able to tell their doctor, hey, I'm feeling a little shortness of breath. That person, by definition, can be counted and has been counted as a COVID probable case. And
So
if that person,
it only has to be one of those things.
one of those things, if a person coughed once and then passed away because they were in hospice care and had been suffering from cancer and they were at end stage and they coughed once, that person could be literally counted as COVID and has been. We have confirmation from the Pennsylvania's Department of Health that they have counted everyone in hospice who died, and everyone that they could count as a COVID, they did. We know that in states like Rhode Island, over 80% of all fatalities have been in assisted living facilities. We know that the national average, according to AARP.com, is ARP is anywhere between 37 and 42% of all fatalities that are said to have been COVID caused are in assisted living centers. And we also know that the 6 states that did not enact lockdown orders did better than states with probable with comparable population sizes and right next door to them. I did a little statistical analysis on that. Every state that locked down did far worse statistically in terms of fatalities and case numbers than the states that did not lock down. So we know this, and the data doesn't have a political agenda. The data doesn't have feelings. Facts don't have feelings. They're just facts. But we're not using those to make policy decisions, and that's the problem right now. So this is one issue with this paper, Doc. And I know, see, this is where it starts getting crazy so quick, doesn't it?
Yeah, it does.
And my first question with this paper is, okay, you're the CDC. Why did you need to outsource the definition of what constitutes a clinical case or a confirmed case to a nonprofit organization not affiliated with our government? That doesn't make sense. That doesn't make sense. And then you see in here all of this information to define everything and what constitutes lab criteria. Well, here we knew we were going to start using PCR testing. Why didn't you define how many cycles the PCR testing has to go? What most people don't realize is that if you cycle a sample in the PCR like 10 times, it's always going to be negative. If you cycle it 60 times, it's always going to be positive, right? And that no states have definitive criteria on how many cycles are supposed to be done. They left that up to each individual lab. And for most of the summer, most labs were running between 30 and 33 cycles of the PCR test. Because what a PCR test does is it basically makes a lot of copies of what might be there to detect whether something is actually there. So the more cycles it takes to detect means the less contagious you are. It's kind of this inverse weird thing I'm still studying.
Okay.
But what's so interesting about it is the CDC not too long ago apparently has changed their guidance in saying that now you have to cycle at 45 or higher, which means
it's always
that
going to be positive.
So it's got a much greater likelihood of being positive now. And then now what are we seeing? Well, cases are starting to explode everywhere. Well, maybe why is because they increase the cycle times, before you get to your diagnosis, which is there's many epidemiologists around the world. I was reading a paper from two in the United Kingdom last night that have grave concerns about this, and they should. It's wrong. But here's the question, Doc. Why didn't they define what the cycle time should be for the PR testing here? You defined all this other stuff, right? You defined epidemiologic linkage, which refers to contact tracing. You've created an opportunity for contact tracing. You've created an opportunity for confirmed testing, but without defining a cycle time. You've created an opportunity for minimal standards of symptomatology to say somebody is COVID positive. You've created all these opportunities to create cases of this. And then when you get down to section 7B on page 6, they have this little ditty right here. Let me read this for your audience, because this dropped my jaw when I saw it. These are PhDs, folks. These are PhDs that are the heads of public health departments, and there are subject matter experts from the CDC on this paper. I'll show you in a second. Section 7B, page 6, criteria to distinguish a new case of this disease or condition from reports or notifications which should not be enumerated as a new case for surveillance. What this is saying is, how do we make sure that the same person isn't counted multiple times? Now, they just went through all of this information up here, and their decision on this as an organization, and the CDC signed off on this by adopting the paper, was that it's not applicable until more virologic data are available. Okay, well, we have a lot of virologic data available, and guess what's never been changed? This. There is still no way for us to identify that a person has already been counted in what is being counted as COVID. So what that means is that the same person can be counted multiple times over and over again. They can definitely be counted again via contact tracing. You don't need any proof to say that someone is probably COVID because they came in within 6 feet of someone who was COVID positive. And none of this data ever gets corrected. None of the data ever gets corrected on this. None of these criterias and methodologies for recording data never gets corrected. So what that tells us is all of the data is compromised, because we don't have a simple basic control of saying, yes, everybody should record the person's name, the person's birth date, the person's gender, and get a photo identification and put that information in for every test that's run, so we can make sure the same person who may be tested upwards of 12 or 13 times while they're trying to get back to work, because some places won't let you back into work if you are testing positive, right? Mm-hmm. If we would have simply collected that person's name, birth date, gender, and some form of photo ID, which everybody has, then we could say, okay, well, that person right there in this national database has been tested 14 times, but they've tested positive 13 times. That 13 times they've tested only counts for one. There is an easy statistical data way to do this, and they declined to identify that here. And what's really troubling about that for me, Dr. Casey, is we're talking about, when we look at the authors, PhD, MD. We're talking about people with advanced degrees that are heads of state health departments. When we look at the subject matter experts, PhD, MD, all right, people with advanced degrees, all right, who have expertise in epidemiology and data collection. And many of the subject matter experts are from the Centers for Disease Control. And it makes me just think, I don't know how to stop sharing.
I'll remove it here.
It makes me question. These are brilliant people. You cannot question their education. All right, it's beyond reproach. But epidemiology and data collection 101 is, for something like this, make sure the same person isn't being counted more than once. Yeah. It's the only way to make sure that we have an accurate handle on all of the analysis the fatality rates, the recovery rates, the how many people per 100,000 are out there. Without that basic control of making sure the same person can't be counted twice, effectively what you're doing is counting the same person multiple times. And in doing so, compromising the data collection and compromising all of the analysis. And if the public health policy is based upon that analysis and the recommendations from that analysis, then that calls into question and compromises the public health policies. It's just this is the domino effect of it all. And it was on, I'm going to just throw something out there for people to chew on. It was because of COVID that we saw an unprecedented number of ballots, of mail-in ballots this year. That was because of concerns of whether or not we were going to be able to go to the voting booth in November. This is the domino effect. This is when the Information Quality Act, which is a federal law enacted by Congress, says that we have to ensure as a federal agency that we preserve the integrity of all data that is collected and published by all federal agencies. And that process is violated. That's a violation of federal law, and it may seem like a little one, but the implications and the ramifications are of a magnitude we have never experienced in this country. Mm-hmm. And I can't be quiet about that. Now again, it's an allegation, okay? But all we're asking for is a grand jury investigation that's transparent and thorough. That's all we're asking for on it.
Yeah, I love what you're doing, man. And I don't know how anyone can look at what you just presented and not see some wrongdoing in it, not see it, just evidence of wrongdoing. And what I love about you, Dr. H, is you're telling people to do their own research, not to trust anything you say, not to take anything you say at face value, but to explore the issue for themselves. And if they agree with you that something's wrong, to join you and to do something about it. And what I see is the exact opposite happening on the other side of the argument. It's very much, don't question, don't dig. We're going to censor anything that doesn't align with our view. Shut up, take our word, and comply. And anytime I see side by side, that raises some serious questions for me. And I'm at the very least going to look into what you're telling me to look into. And man, I love that you're doing this. I appreciate you stepping up to the plate on this. Anytime I have these conversations, man, I love to give you the last word and tell people whatever you want. What does the world need to hear from Dr. H today?
Well, the first thing is I want to make sure and express a tremendous amount of gratitude for everybody who's invested their time with my team. I have met some of the most incredible Americans that I never would have known otherwise, and it's a gift. And I want to express my gratitude to everyone like yourself and who's getting this information out there, because this is what makes us Americans, that First Amendment freedom of speech. We have the right to decide for ourselves. I'm tired of the media telling us everything we need to know. And this is how you should feel. Stop. I'm not outsourcing that to anyone. I have a brain. I'm going to use it. I'm not afraid to use it. I think the big thing that I've heard is that Americans we're exhausted. And I'm right there with you, everybody. We're exhausted mentally, emotionally. We're angry for a lot of different reasons. And I think in a lot of cases, very justifiably so. And we've been pushed to our limits, and that's a dangerous place to push a large population of people historically. And I think that what can help us do I just got this new Instant Pot pressure cooker that I'm in love with now. I think one of the things that can be the release valve for us is when you say, I don't know who to trust, don't trust anyone. Don't trust the media. Don't trust me and the research. Read what we're saying and you decide for yourself. And if you think what we've put together is garbage, I have no problem with that, because you have informed yourself and you are making the decision. But if you think that what we've done has some merit, and I hope you do, then my humble request to you is do something about it beyond being outraged on social media. Contact the Department of Justice, contact your U.S. attorney, demand an investigation, a grand jury investigation into this, and then share this information with your friends, with your family, on your audiences, and be proud that you have demanded a grand jury investigation, that you are doing more than just subjugating your participation in your governance to a vote every 4 years. Clearly, that does not work for us. And America is the spirit of this country, the intention of what we are is, I'm getting goosebumps right now, is beautiful. It is great. We are a great nation of good people. But now is the time for us to prove it. And we can only prove that through our deeds. So that's my message to Americans.
I love your message, man. I love it. It's an honor to be in your space, Dr. H, and I would love to do this again as you continue to keep doing what you're doing and continue to petition. And I'd love to keep having these conversations with you.
We'll do it again. We have some information we're going to be sharing about our research that got cut out of the paper. We want to epilogue that if we can, and we'd love to share that with your audience. And we're getting educated on PCR cycling, and when I feel like I'm educated enough to speak about it intelligently, I would love to share that with your audience, because it's a big deal. It's the difference between a test being positive or negative. But this is why, Dr. Casey, you and I both know, right? You can't be diagnosed with something without also having symptoms. You gotta have symptoms. You gotta be coughing. You gotta have kids gotta have a runny nose, and then we go, yeah, they're sick. You can't just be, how do you feel? I feel fine. Well, you tested and you got COVID. It's like, really? Where? It's strange. So anyway, thank you so much for having me. We really appreciate it. Yeah.
Thanks for doing this, man. This is, every time I talk to you, it's just, my jaw hits the floor. It's just, it's amazing to me what you're doing. And I want to thank you for that. And for those of you watching, Dr. H, you're going to like this. As you know, censorship on natural health topics, especially this one, is alive and well. And a lot of the videos that we've put out the viewership just isn't getting what it used to be. I actually tried sharing this to your page as we were going, and there was some technical difficulty. It wouldn't allow me to do it.
Of course.
So if you find this information valuable, if you know a specific person, if you're thinking of that 1, 2, 3, 5, 10 people who need to hear what Dr. H has to say, I would encourage you, share it with them, share it on your page. It's not going to spread the way it used to, like wildfire, the way these videos used to. We really need your support in sharing, commenting, liking, and really helping get this information out. So Dr. H, thank you, sir. I'll look forward to talking to you again.
I can't wait. And we'll keep you aware of everything that we're doing so you can help your audience become more and more engaged in what they can do as well. That's what it's about for us.
Thank you, Matt.
All right. I appreciate you, sir. Thank you.
Have a good weekend, everybody.